Hey everyone, and welcome to the channel. Today, we're going to talk about something really important and personal. Teenage pregnancy and the changes that happen to your body. If you're a teen who's just found out you're pregnant, you probably have a million questions and are feeling a mix of emotions. That's completely normal. The journey ahead involves a lot of changes, both emotionally and physically. This video is here to be a calm, factual guide, walking you through what to expect week by week, specifically from the perspective of being around 15 years old. Remember, knowledge is power, and understanding what's happening can help you feel more in control. And please know you are not alone in this. There are resources and people who can support you. Let's start from the very beginning, the first trimester, which is weeks 1 through 13. Technically, week 1 and 2, you're not actually pregnant yet. Doctors count pregnancy from the first day of your last menstrual period. Conception usually happens around week 3. By week 4, you might miss your period, which is often the very first sign. You might not feel much different, but inside, a tiny ball of cells, called a blastocyst, has implanted in your uterus. By weeks 5 and 6, things start to feel more real. This is when many people experience early pregnancy symptoms. Morning sickness can hit, and despite its name, it can happen at any time of day. You might feel unusually tired, like you just can't get enough sleep. Your breasts might feel tender or swollen, and you might find yourself needing to use the bathroom more often. These changes are all caused by a surge in hormones, especially one called HCG. Emotionally, you might feel overwhelmed, anxious, or even excited. It's a roller coaster, and it's okay to feel all these things. As you move into weeks 7 and 8, the embryo is growing rapidly. It's now about the size of a blueberry. Your symptoms might intensify. The fatigue can be very real, making it tough to get through a school day. Food aversions and cravings might also kick in. Foods you used to love might suddenly seem unappealing, while you might crave something totally new. It's also common to experience mood swings. One minute you might feel happy, the next you might feel tearful. This is all thanks to those fluctuating hormones. It's so important during this time to have someone to talk to, whether it's a trusted adult, a school counselor, or a friend. Weeks 9 through 13 round out the first trimester. The baby, now called a fetus, is developing major organs. For you, the morning sickness might start to ease up a bit towards the end of this period, though for some it can continue. You might notice your clothes starting to feel a little snug around the waist, even if you don't have a visible bump yet. Your uterus is expanding, but it's still tucked inside your pelvis. You might also notice changes in your skin, like breakouts, or your hair might seem thicker. This is also a crucial time for prenatal care. Seeing a doctor or visiting a clinic like Planned Parenthood is vital to ensure both you and the baby are healthy. They can provide essential advice on nutrition, what vitamins to take, and answer all your questions without judgment. Now let's talk about the second trimester, weeks 14 through 27. For many, this is the honeymoon phase of pregnancy. You might start to feel more energetic, and the early intense symptoms often fade away. Around weeks 16 to 20, you'll likely start to show a noticeable baby bump. As a teenager, this can be a really big deal. It makes the pregnancy visible to everyone, which can bring up a lot of new feelings and social challenges at school. It's important to surround yourself with supportive people. One of the most exciting moments happens during this trimester. Feeling the baby move for the first time. This is called quickening. At first, it might feel like little flutters or bubbles, and you might not even be sure what it is. But soon those movements will become stronger and more distinct kicks and punches. It's a powerful reminder of the new life growing inside you. Physically, as your belly grows, you might experience some new aches and pains. Round ligament pain, which feels like a sharp jab in your lower abdomen or groin, is common as the ligaments supporting your uterus stretch. Backaches are also very common. Your skin might continue to change. Some people develop a dark line down their abdomen called the linea nigra, or darker patches on their face. You may also see stretch marks appearing on your belly, hips, or breasts. Using moisturizers can help with any itchiness, but stretch marks are a very normal part of pregnancy for people of all ages. By the end of the second trimester, around week 27, The baby is fully formed and is mostly focused on growing bigger and stronger. Your bump will be very obvious now. It's a good time to think about comfortable clothes, like leggings and stretchy tops. Your body is working hard, so make sure you're eating nutritious food and staying hydrated. Gentle exercise, like walking or swimming, can also help with energy levels and aches, but always talk to your doctor first. This is also a time when you will be having regular prenatal checkups to monitor the baby's growth and your health. Finally, we enter the third trimester from week 28 until birth. This is the home stretch, but it can also be the most physically challenging. The baby is growing quickly, which means your bump is getting bigger and bigger. This can make simple things like tying your shoes or getting out of bed feel like a workout. You'll likely feel the baby's movements very strongly and regularly. Common symptoms in the third trimester include shortness of breath, as your expanding uterus puts pressure on your diaphragm. Heartburn and indigestion are also frequent complaints. You might have trouble sleeping due to discomfort and needing to use the bathroom often. Swelling in your hands, feet, and ankles is also normal, but it's important to mention it to your doctor to rule out any complications. You might also experience Braxton Hicks contractions, which are like practice contractions. They feel like a tightening of your abdomen but are usually irregular and do not get stronger over time. As a 15-year-old, navigating the physical demands of the third trimester while trying to keep up with school and social life can be incredibly tough. Your body is preparing for labor, and you're preparing for a massive life change. It's okay to ask for help. Let your family know you need more rest. Talk to your teachers about accommodations you might need at school. Your focus needs to be on your health and the health of your baby. During these final weeks, your doctor's appointments will become more frequent. They'll be checking your blood pressure, the baby's position, and talking to you about signs of labor. Attending childbirth education classes, if available, can be really helpful. They can prepare you for what to expect during labor and delivery, and teach you breathing techniques and coping strategies. And that brings us to the end of the pregnancy journey. Every pregnancy is unique, and your experience might be different from what we've described. The most important thing is to stay informed, prioritize your health, and build a strong support system. Being pregnant as a teenager is a huge challenge, but you are capable and strong. If you are a teen facing an unplanned pregnancy and feel scared or alone, please know there is help. You can talk to a trusted adult like a parent, school counselor, or family member. You can also reach out to organizations like Planned Parenthood or the National Runaway Safe Line, who can provide confidential support, resources, and options counseling. Your well-being matters. Thank you so much for watching. We hope this information was helpful and empowering. Remember to be kind to yourself and to seek out the support you deserve. If you found this video valuable, please give it a thumbs up and consider subscribing for more supportive content. Take care.